The Bono Regional Health Directorate of the Ghana Health Service has dismissed rumours suggesting that the region has recorded cases of coronavirus. At a press briefing Tuesday night, the Bono Regional Deputy Director of Public Health, Dr. John Otu, said the Directorate is yet to receive results of 29 suspected cases undergoing testing. He said these were identified in the enhanced surveillance system.
For all the samples that we have tested, we have received results for 24 of them, and all of them are negative. The remaining 5 samples we are yet to receive results for the remaining 5. But I will want to say categorically that the Bono region, as well as the Ahafo and Bono East region, have recorded no positive case of COVID-19. Our surveillance system is up. We've enhanced our surveillance system, and we are following up on all alerts and rumors that we get as a region. We are collaborating with the immigration services to ensure that all persons who come into the country through unapproved routes, and also persons who came into the country since 9th March through our airport, are followed up, and we ensure that none of them is having any ill health. We have our contact tracers who are in all the sub-districts and are helping with the investigations of alerts and contacts that we have received so far. We are encouraging everybody to observe the rules or protocols that we have spelled out to help us all protect ourselves from being infected with the COVID-19 outbreak. We are encouraging everybody to, as much as possible, stay at home if you don't have any business doing outside. Please stay at home.
Now, the Bono Regional Health Director, Dr. KofiIssah, however, called on the district health teams and other stakeholders to remain steadfast in their roles to ensure total compliance of all directives if they are to avoid the spread of the coronavirus in the region.
People keep trooping in and out, but the clear thing is surveillance. Everybody is in a house or two. Even if you mount 1,000 barriers, people will go through the bush and come in. But they will by all means sleep in a certain house. They will by all means interact with certain people. And that is why we have informed the districts to inform the community-based surveillance volunteers and the assemblymen that if there is any situation where they think that they have to draw the attention of the sub-district authorities and the district authorities and our attention, they should do so. There have been several instances where they have come to report people. Some haven't been very nice situations anyway. But then all the same, we have been able to resolve this. When people come in, please, they shouldn't stigmatize them. The normal thing of making sure that we should all be healthy, so that at least we interact with them and make sure that the fellow who is involved is safe, we are all safe. So that if it means that we have to test, we will test the fellow, instead of actually putting fear and panic in there.
Now, Dr. Issa, who said they have enough personal protective equipment to carry out their mandate presently, insists they're ready in the event of a confirmation.
Let me state here categorically, our health system have been said to be weak, but our health systems have been geared towards infectious diseases. For a whole long, we have been in that mode. So, COVID is not, as far as infectious diseases are concerned, it's nothing new to us. It is just that it started somewhere and it's reached us. As we talk, there is CSM in this country, and we battle CSM, we battle cholera. So as much as possible, the public health of prevention have been in, and though they don't work very perfectly, we don't wait until people need to hospitalize, because if we wait until they get hospitalized, then those of us here who would have malaria or you are going for your hypertensive, that you won't even get the chance to enter the hospital. So regional hospital together with other hospitals, are ready. It's a whole what do you call a whole linkage of hospitals, depending on how far somebody is. It is not the normal referrals from A to B and all that. That is our largest referral center. But as much as possible, as far as COVID is concerned, it's not everybody who would need to be admitted. So when they get there, we will cross that bridge as far as regional hospital is concerned.